Now let's see some of the factors that inhibit the growth hormone secretion. Increased blood glucose and blood-free fatty acids, obesity, aging, exogenous growth hormone, and growth hormone inhibitory hormone, that is somatostatin and somatomedins. All these factors, they cause decrease in the growth hormone secretion. So exogenous growth hormone is the one which is given from outside. So this actually inhibits the secretion by, again, negative feedback mechanism. Moving on to actions of growth hormone. Its main role is in growth metabolism. It causes growth of almost all tissues that are capable of growing. It increases differentiation of certain types of cells, and it also increases mitosis, and it promotes bone and cartilage growth. So any hormone, it has an effect on metabolism as well. So let's see the role of growth hormone in different metabolisms one by one. In carbohydrate metabolism, growth hormone is said to have a diabetogenic effect. That is, it tends to increase the blood sugar level by decreasing glucose uptake in the tissues, increased gluconeogenesis by the liver, and by causing increased insulin secretion. You might wonder why it is said to be diabetogenic when it causes increased insulin secretion. The fact is that growth hormone causes insulin insensitivity, that is insulin resistance. So in spite of increased insulin secretion, there will still be increased blood glucose level. So that is why the effect of growth hormone on carbohydrate metabolism is said to be diabetogenic. Growth hormone is said to have a protein sparing effect on protein metabolism. It promotes protein deposition in tissues and increased protein synthesis. Protein synthesis is increased by increased amino acid transport through the cell membranes. So when there is more amino acid inside the cell, more proteins will be formed. So even when there is absence of more amino acids in the cell, RNA translation is increased. And also nuclear transcription of DNA to form RNA is also increased in the presence of growth hormone. Not only that, it also decreases the catabolism of protein and amino acids. So that is why it is said to have a protein sparing effect. It promotes fat for utilization in the place of carbohydrates and proteins. It causes release of fatty acid from adipose tissue and enhances the conversion of fatty acids to acetyl coenzyme A and its utilization for energy. So it is because of this it is said to have a ketogenic effect as well. While looking into the actions of growth hormone, they found out that growth hormone has some direct effect and it acts through some other intermediate substances. How did they find out this? They grew chondrocytes out of the body, and when growth hormone was injected into it, it did not grow. But at the same time, when they injected growth hormone into the chondrocytes of a living animal, they found out that the chondrocytes grew in size. So they broadly classified the actions into direct actions of growth hormone and via insulin-like growth factor. So this is the intermediate substance that through which most of the actions of growth hormone is expressed. So the direct actions are decreased glucose uptake into the cells, increased lipolysis, increased protein synthesis in muscle and increase in lean body mass, and increased production of insulin-like growth factors. These are said to be the direct actions. Actions of growth hormone via somatomedin are increased protein synthesis in chondrocytes, increase in linear growth, increase in lean body mass by increasing protein synthesis in muscle, and increase in organ size by increasing protein synthesis in most of the organs. Now let's see some conditions which are caused by either increase or decrease in the synthesis of growth hormone. Panhypopituitarism is the condition in which there is decreased secretion of all the anterior pituitary hormones. It can be either congenital or acquired. When it is acquired, most often it is caused as a result of tumor. So when all the hormones are decreased, it can result in dwarfism, which is due to decrease in secretion of growth hormone, and when there is decrease in thyroid stimulating hormone, it results in hypothyroidism, and there will be decreased glucocorticoid production and loss of sexual functions due to decrease in hormones like FSH and LH.